Now the next topic is radial nerve. So radial nerve supply all the extensors of forearm. Okay, it has a branch that is posterior anterosseous nerve. It supplies the extensors of thumb and fingers. Okay, so PIN especially supplies the extensors of thumb and fingers. Okay, so now there are various level of nerve injury. Very high radial nerve injury. So very high radial nerve injury, it is at the level of axilla. So triceps supply is disrupted. Tricep supply is disrupted. So patient is not able to extend the elbow. High radial nerve injury, it is at the level of midshaft humerus. So patient will present with, because high radial nerve injury at the level of humerus, the all extensors of forearm, all extensors of thumb, all finger drop. So all extensor and sensory loss. So that's why there is a thumb drop, finger drop, wrist drop, and sensory loss, because it supply the sensory on the dorsal aspect, radial nerve. Okay. Now injury proximal to the ECRL, because ECRL, extensor carpi radius longus, is help in extension of wrist. So if there is an injury proximal to the ECRL, there is a wrist drop. If injury distal to the ECRL, there is no any wrist drop, because ECR is already supplied. So there is no any wrist drop. PIN, that is posterior anterosseous nerve, it mainly supply the finger and thumb extensors. So injury to the posterior anterosseous nerve leads to finger drop and thumb drop. And if there is radial nerve injury, so you have to apply the cock-up splint. Cock-up splint you have to apply. Okay. This is radial nerve. So radial nerve supply all the extensors of forearm, all the extensors of thumb, all the extensors of fingers. Okay. And there are various level of radial nerve injury. It could be very high radial nerve injury at the level of axilla. It could be at the level of midshaft humerus, or it could be proximal to the ECRL and distal to the ECRL. So you have to understand ECRL is the main wrist extensor. So if there is proximal to the ECRL, then it is wrist drop. Wrist drop is present. If it is distal to the ECRL, there is no any wrist drop. And there is a branch that is posterior anterosseous nerve. Like anterior anterosseous nerve is the branch of median nerve, and posterior anterosseous nerve is the branch of radial nerve. So posterior anterosseous nerve supply mostly the thumb and fingers extensors. So if there is an injury in PIN, then patient will present with finger drop as well as thumb drop. And so you have to apply a cock-up splint. Cock-up splint you have to apply for the radial nerve injury, and it supplies the dorsal aspect of hand. Sensory supply is via the radial nerve. Thank you so much.